Hello, everyone, and welcome to the first official discussion on how in-home non-medical private duty companies can bill Medicare Advantage starting January 2019. I'm Robin Krupa with Stat Home Care Consultants. Ever since CMS granted permission for Medicare Advantage plans to expand benefits to in-home non-medical and community-based services, we've all been anxiously waiting to learn more details on which plans would offer this benefit and how we can bill this insurance to grow our private duty businesses. Today, Lynn Lombarda with iMark Billing joins us to discuss all the latest details. Lynn has billed over $800 million in claims to all types of insurance companies, from Medicare to Medicaid and commercial insurances. Hi, Lynn, and welcome.
Thank you so much, Robin, for having me. I really appreciate this opportunity. And I'm actually really excited about this news. I think everybody is. On the insurance side, they're very interested in expanding this coverage because really what this is all about is to reduce emergency room visits. Mm-hmm. And the industry really feels that offering these non-skilled in-home services are really the way to do that. Now, on the other hand, the home care community obviously is thrilled as well, like we all are, because it's going to be another revenue source for agencies, and we really need that. But of course, there's a ton of questions out there, Robin.
You are so right. There's so many unanswered questions. And the main one is, how do we get set up to bill for the services we provide? So I compiled a list of the most common questions I hear from my home care clients and thought we would just go down the list. Question number one, can any in-home non-medical private duty company bill for these services, or do they have to be accredited like a skilled home health care is? Because, they have to be accredited through JACO, CHAP, or ACHC.
That's a great question. That's actually something I've heard a lot as well from our customers. So what's funny is I was actually at a home care conference last week, and I posed this exact question to a senior executive at ACHC, and they said that at the moment, as far as they can tell, there are no requirements. Wow! So this is pretty fantastic. Yeah. Now, of course, this could change in the future since all of this is really unfolding so quickly. There could be some state-specific requirements, she did mention at some point, but for now, it seems like there are no requirements.
So question number two, will clients who have traditional Medicare automatically have this benefit?
So the answer to that is simply no. Traditional Medicare is very different from Medicare Advantage, and this is a big confusion that agencies have, the difference between traditional Medicare and Medicare Advantage. It could be an HMO, a PPO, it's a private plan.
So that transitions nicely into question number three. What exactly is Medicare Advantage?
Medicare Advantage plans can provide additional services, right, that traditional Medicare doesn't. So, for example, some of the Medicare Advantage plans would provide free eyeglasses or prescription drug coverage. And even now, we're clearly talking about non-skilled in-home services that are going to be provided by MA plans. So these MA plans are typically offered through United Healthcare, Blue Cross, Humana, Aetna. All of those large insurance companies out there are the ones that offer the MA plans.
Question number four. In addition to Medicare Advantage, what other types of insurance do you commonly see billed by in-home non-medical companies?
Clearly it's going to vary between, state to state. But typically we bill a lot of Medicaid waiver programs, for example. We bill VA programs, lots of veteran affairs, long-term care insurances, workers' comp insurances, and of course the commercial insurances for non-skilled care, that are through United, Blue Cross, Aetna, Humana. That's typically what we do out there, what we see out there.
Question number five. What is the actual process for me to get contracted and start billing insurance?
It's just a matter of knowing, what are the insurances in your area. And in fact, some of those large insurance companies, they offer lots of different plans. So United Healthcare, Blue Cross, they can offer, like a managed Medicaid plan. They can offer a straight commercial insurance plan. And of course, what we're talking about today, they can offer a Medicare Advantage plan. So what's interesting about the Medicare Advantage plans that are offered by United, Blue Cross, Humana, is that in some cases, you don't have to be contracted with the insurance company in order to accept the patient. So that's what makes this really interesting, because I would say a good 70% of the Medicare Advantage plans don't require you to be an in-network provider. So here's an opportunity for agencies now on the non-skilled, private duty side, whenever they get a referral from a patient that has a Medicare Advantage that needs non-skilled care, it would be a matter of doing the eligibility. Even if you're not contracted, I would recommend to do that and find out, one, if the Medicare Advantage plan even covers non-skilled in-home services first. And if they do, the next question you would ask is, do they accept out-of-network providers? If they do, then that's an opportunity where the agency could potentially take that patient.
Question number 6. Is there a way to find clients in our service area that has this specific Medicare Advantage plan?
So that's a great question. And it's a little tricky, but let me give you a good tip. Oh, believe it or not, you can just Google it. Put in the search, put Medicare Advantages in my area and add your zip code on the Google search. And you'll just get a listing of all the Medicare Advantages that are popular in your area. Now, clearly it's going to be the large players like we talked about, Blue Cross, Humana, Aetna, all those guys. But there could be some other ones that are more local to your area, and you'll find them by just searching them on Google or calling a physician group.
Okay, well, this is our 7th question and final response in today's webinar. Should I outsource billing, or is this something a small agency can do on their own?
Since I have a billing company, using a billing service like ours to handle the entire billing process is really the easiest and best way to go, because you're not going to have to worry about getting paid, and you can focus on getting those referrals in the door. So the way we work with our customers is, we don't have any contracts and we don't have setup fees. You only pay us based on results. But typically for the commercial insurances, you're looking at 30 days. Okay. Some insurance companies, especially some of the smaller ones, could fall into a 60-day time frame, but typically it's 30.
All right. Well, thank you, Lynn. We appreciate you taking the time to be with us today.
Absolutely. Absolutely. Thank you so much, Robin, for having me.
If you would like to contact Lynn, you can visit her website at imarkbilling.com, call or email her at the address you see on your screen. In a recent update from AARP, only 3% of the 3,000 Medicare Advantage plans will be offering this benefit to members this year. The insurance companies are looking for private duty businesses to work with who can show quality measures and performance outcomes that demonstrate the ability to keep clients out of the hospital. Policies, marketing plans, and specialty programs must be in place, and the process can take many months. Click below to join our growing membership, where together we learn from insurance experts who can help us find plans in your area like Humana and United, hear from them directly in webinar discussions, learn how to set up an adult daycare, and of course, keep up to date on how you can build private duty home care services. Again, click below for all the latest. I'm Robin Holland Krupa.